Okay, so good afternoon again, and today I'm going to present my research aimed at improving the efficiency of out-of-stock risk management in the supply chain of a pharmaceutical company. And let me start with the, let me start with the relevancy of this topic. Pharmacy is considered one of the most valuable industries it is the basis of national healthcare systems affecting these parameters listed on the slide. And nowadays globalization has made supply chains of pharmaceutical companies and basically every company more wide and widespread, and also quite distant points from each other make supply chains more prone to some disruptions and out of stock. And so another thing is that pharmaceutical market is quite big, and there are many large companies operating there. So and there is a wide range of substitute drugs. So any out of stock, especially in long run, can cause severe financial damage for the company. And the most important thing is that out of stock of drugs, and especially essential drugs, may cause severe damage for patients' health. And so for my research, there was a company that I based this research on. This is an international company, but I will go into focus on its Russian segment. And as you can see, its logistics network is quite widespread. And in Russia, it works with distributors, pharmacy distributors as its clients. And while I was investigating this company, I of course turned my attention to logistics KPIs of this company, and the one that really stood out to me was the one parameter called, or maybe that represents the number of SKU or items that are not available for sale, so they are in the status of out of stock. The reason why this particular parameter stood out to me so much is that the company is really focused on decreasing this parameter. However, as you can see on this graph, it doesn't do that much of a good job, especially in the second half of the 2020. Unfortunately, this graph really resembles the pandemic and the crisis that we had in the end of 2020. However, some more in-depth of causes of out of stock we will start on that a little bit later. And another parameter that I explored was rupture, or basically the difference between orders that were placed for the company and orders that were fulfilled by the company. And as you can see, again, in the second half of the 2020, or maybe the very end of it, this parameter was really peaking, and as you can see, the lost sales basically were more than 30% of the forecast of monthly sales of the company, which is really crucial for it. And now I'm going to go into the deep of why this happens, and I will show you basically this graph, but with the causes divided by the causes. So as you can see, these are oversales, regulatory causes, some of the plants, and quality, and this is how this graph looks essentially divided by those causes. And now let's look more into them. What is oversales? Oversales is basically the situation when the forecast of the demand was severely lower than the fact orders. So that is why which causes the decrease in the stock levels, and therefore its lack in next cycles. The next group of problems are related to the work in plants. There's a lack of capacity, some technical issues, and so on. Also quality. Some products can be produced in the quality that is not suitable for the market, for the patients, and also some of the drugs can be damaged during handling or distribution and so on. And the last of the biggest causes of out of stock in this company is regulatory causes. They are often connected to regulatory and registration of the products, track and tracing of drugs in the supply chain. And now to provide and decide on solutions for these problems, it's better to also look in depth of this risk and make a structural analysis. And what this particular analysis featuring what causes the out of stock also showed me is consequences, and that the fact that consequences can be divided into two groups. One of which is lost sales, the group of consequences that is evaluated basically numerically in number of units not sold or in the currency. And the other half of consequences is not that easy to evaluate. And moreover, the main thing about them is that they do not occur right away when the out of stock of the product started. They can occur, or maybe the likelihood of them, these consequences to appear is the fact that out of stock lasts long enough so that it, so to say, comes, so that it separates from being only the company's problem to the problem of its clients, patients, drugstores, and hospitals. So that is why these can cause severe health damage and market share loss. So let's look more into the time point of the out of stock. So this is how I presented, so to say, timelines of out of stock, or the phases that a particular item has to go through in order to fulfill the out of stock that was caused earlier. Excuse me. So as you can see here, some of the phases like production and transportation can really be reduced by the company. However, if we look at the graph of out of stock and its causes again and overlay the graph of incomings or the deliveries, we can see that in these peaking points of deliveries, or when they increase gradually over the long period of time, that's when most out of stock situations happen. So this led me to conclusion that these two phases, like warehouse acceptance and market release, related to registration and quality release, they cause some impact elongating out of stock. And on this graph we can also see that in 2020 the later the item was delivered to the company, the longer it took for it to be accepted to the warehouse and released. This was happening because of the, so to say, lines in front of the warehouse or in front of laboratories or those institutions that were responsible for releasing or registering those drugs. And so, how to solve this problem? Let's imagine that now in front of our warehouse was formed such a line of drugs and drugs that have different statuses. Some in out of stock, some of them are close to the out of stock. And the solution here is to make a prioritization based on ABC XYZ analysis that will show us what products are a high priority and what are prone to the risk of out of stock maybe, and that the products of high priority are the ones to accept and release the first. Onto these value-based metrics, we can also add additional priorities like the product being in out of stock, the product being urgent for patients, and it participating in governmental contracts or maybe tenders. So this is how we move on to another prioritization, where the first one to accept and release is the one more valuable and being out of stock. Of course, this is a very simple example. However, on the real scale in the company, and especially when the market flow, or sorry, not market, but material flow is increasing significantly in some periods of time, like seasonal allergies and so on, this instrument and this methodology will be crucial for the company. And the other thing is how to communicate our priorities to those who are responsible for those processes, such as warehouse acceptance and registration or regulatory processes. This is the information flow structure as it is for now. As you can see, warehouse regulatory department do not know the long-run plans, supply plans. They also gain information only by BUs. What is the BU or business unit? The whole profile, I would say, of the drugs, the medicines that company has is divided into several business units, which is assigned to some of the planning specialists. And these planning specialists are working on pushing their products to be released first, to be accepted first. However, this might be harmful for the company as a whole, because we have already seen that some of the products are more valuable, some of them in their different statuses. So it is crucial to see the whole picture. That is why I have remodeled some of the informational flows in the company, sharing the long run plans, consolidating all the reports, not giving them by BU, and also prioritizing those who can be pushed, those products, in order or with considering different factors. And so as a result, we have, in this research, I have improved the department communication, information consolidation was implemented, also operational analysis like ABC and XYZ analysis, and also this is what led to the rupture to decrease. So if those things were implemented or have been implemented in the end of 2020, this is how rupture graph would have looked. As you can see, it would decrease by 40%. Therefore, providing patient safety, companies' image protection, market share preservation, and also financial benefits, obviously. And so to conclude, I would say that this specific research was made in a quite narrow research field, as it was researching not only supply chains and processes in it, but specific pharmaceutical supply chains, and also risk management and them, and to be more specific, the risk management of the risk of out of stock. And it also used a combination, or I would say even layers of methodologies to apply in order to find out what the real problem is. And also it has taken quite a specific, I would say, approach, mitigating those consequences by decreasing the time of out of stock. Overall, this research I consider having scientific novelty and also professional significance for the company. And as for the further research, I would like to explore risk management a bit more, maybe implement process modeling and process optimization, examine organizational structure and see if something is wrong there that is causing those communicational disruptors, and also accurately evaluate financial impact, so that to convince that this research is really relevant even on financial level. So thank you so much for your attention. I will be happy to answer any of your questions.
Спасибо, Maria. Any questions, please?
Yeah, I have a question. Maria, can you please name the definite types of risks which you analyzed in your research? What risks were examined?
So as for the risk, the main risk I was researching was the risk of out of stock, which is caused by, according to structural analysis, caused by different situations and factors. But as far as this particular methodology goes, the thing that is to consider the risk is out of stock or drug or medicine shortage. I hope I answered.
Yeah, but aren't there any other risks in the pharma industry? I mean, why you chose this one?
Because this is the one that really stood out to me when I was analyzing a logistics KPI of the company, and I saw that this particular parameter of out of stock and rupture, they were very relevant for the company. However, the mitigation and the overall management of these parameters and risk that are associated with them is, so to say, not very made out and thought through.
So I'm really interested, actually. We talk about the manufacturer. Let's talk about the retail. Let's just touch some situation with government regulations, and for example, some countries' sources banned, and there is another risk. And just actually, it is really interesting. How you think that type of risk would be managed? If some sources from some country are banned and can't be imported into the country, how would you deal with this type of risk?
Oh, yeah, exactly. I see what you mean. These types of risks, or maybe not really risks, but risk factors, or maybe risk situations. So the risk factor being some political instability, causing the countries to argue and close each other's transportation and supply chain disruption causing. So this basically will also lead to the out of stock risk, and the way to handle it, as I have already said, there is not much that can be done to solve the such problems, because we are not able to really, as a company, not able to affect how the government is communicating or whatever with other countries. So basically the only thing we can do about that is to try to maybe, of course, find some other suppliers and so on, but in pharmaceutical industry, it is not also not always possible, just because of some rights and some of the drugs and APIs, maybe active ingredients, they can be created only by several, only company, which is why, it depends really.
Okay.
Спасибо. Я думаю, что мы на этом закончим вопросы.